So I took subscription of Speed, and I stuck on to the videos provided by the Speed. I mostly concentrated on the INI part of the coaching, of the videos. There are few INI focused videos.
I bring in all the wishes and greetings on behalf of all the faculty members of Speed Medical Institute to Dr. Abishek A.P. for scoring rank number 1 in AML, in specialty, super specialty of MCH head and neck onco surgery in NESS session November 2025. Congratulations to you, doctor.
Thank you so much, sir. Thank you so much, sir.
Great to have you on board today for a discussion.
Yes, sir.
Can we know a brief background from where you started till date, what all you have done?
Yes, sir. So actually, I'm from Trivandrum, Kerala, sir. Then I did my UG from Government Medical College, Thoothukudi in Tamil Nadu. After that, I did my MS in END from AIMS Raipur. I also cleared the DNB END during my time after my MS in AND. Then after that, I've been working as a senior resident in AIMS Kalyani now, sir. So
Great.
throughout this time, I was like trying for head and neck surgery, MCH seat, sir. This time I've tried able to crack it.
Wonderful, wonderful.
Yes.
Excellent. And can we know why MCH head and neck onco surgery? Why, what inspired you? Why you got that kind of a special interest for that?
Yes, sir. So actually, sir, during my time in AIMS Raipur also has MCH seats in head and neck onco surgery, and these MCH candidates used to be within our department of END only. So I used to have a lot of exposure with the head and neck onco cases, and during my 3 years of PG, I found it more interesting to work in and also be a part of the onco surgery operative team. So during my PG time itself, I had decided that if I want to pursue something as a career, I would be more inclined and more I like to do something of that sort, sir, in MCH and head and neck surgery.
Great.
Yeah.
Now, once you decided that you wanted to do MCH head and neck onco surgery, what you did, how you started the preparation, how you made your preparation and to reach topmost rank today?
So for my preparation, the obvious strategy was the only available coaching center is Speed only, sir. So I took subscription of Speed, and I stuck on to the videos provided by the Speed. So Teja Kandamani sir has taken amazing classes in Speed. So I mostly concentrated on the INI part of the coaching, of the videos. There are few INI focused videos. So my focus was to get a seat in INI only. I was not much interested in taking under NEET SS. So I was focused on INISs, and I used to watch videos which are focused on INI. So I watched all the videos. Then I tried to read. There are no particular head and neck targeted books. So I tried to read the head and neck part from Devita, from Bailey, and also from Sharon Maran and our other END books. I tried to cover all these books. Then, obviously, from the help of Speed, then I also gave a few GTs. I gave around 6 GTs which are available in Speed also, sir. Then, something I would like to tell my juniors is that I didn't shy away from using some AI tools. I really took advantage of tools like Perplexity and Notebook LM for my preparation strategies. I uploaded a few chapters and textbooks onto it, tried to do a lot of MCQs from it, tried to make flashcards out of it. I revised a lot of points using these AI tools. So that was my also for INI, a lot of questions come from very recent advances like ongoing trials, very recent and ongoing trials, then recent ATA guidelines. So I try to be aware of all the advances that are happening, all the new trials which are happening, and also AIMS has a tendency to ask very recent trials. So again, I try to like go through all the existing literature to find what are the new trials which are happening right now. So I kind of foresaw that there will be some question coming from which drug is coming in this trial. So I try to predict such kind of questions also. So that's how I prepared mostly.
Great. It was very, very precise and to the point.
Yes, sir.
That can we know the number of questions you attended this exam?
Sir, I don't know exact numbers, sir, but I think it's somewhere between 70 to 75, sir.
Great. Now, can we know about the paper? How was the paper was there? What are the most specific areas or important areas? Which are the areas covered? Can you say something on that?
Understood, sir. So this time I found that paper to be a bit more difficult than the last papers. There out of the 80 questions, 50 questions was from core head and neck onco surgery, and 30 questions were from the general surgery part. Where it is proper core general surgery parts. And in head and neck surgery, it was proper like there was a lot of questions from trials, from the recent ATA guidelines, then staging, management protocols, recent advances, robotic surgery. So that kind of format aims question papers usually they kind of tend to follow all these formats. The extra the bouncers were from general surgery part, the 30 questions which came from general surgery part. Honestly, I hadn't prepared that much into general surgery, but the only thing which I have watched is you have put up a lot of recall videos on YouTube, lot of recall videos from I think from 2000 to almost 2020 to 2025, 5 years of recall sessions. I had watched all those 5 to 6 videos which is available on YouTube, and I had also like used like I told, like I used Notebook LM to make notes out of your YouTube videos, and I just revised whatever you have taught in those YouTube videos.
So
So
you load the YouTube videos in Notebook LM, it gives notes, is it?
yeah, yeah. So I had selected I think around 10 of your videos, or 10 of your YouTube videos. I had loaded everything into Notebook LM and asked it to make it into MCQs. I asked them to make it into notes. I asked them to make it into flashcards. So using flashcards of your YouTube videos, I prepared for the general surgery part.
Is it okay that you can share with me? I can have a look at it after
Yeah,
the.
definitely I'll share with you, sir. So it took me only like around 1 or 2 days, no, just one day to prepare for the general surgery part. So I was able to cover maybe like 50-60% of the core topic of general surgery using that, sir, which I found is very useful for me in that way, sir.
Fantastic.
Yeah.
Can you share something on the interview?
So interview, it was an online interview. There was a panel of 7 faculties. I think they're all from AIMS Delhi faculties only, sir. So it was for me. It was a very kind of formal interview. They didn't ask much. They were like, straight to the point. Each faculty asked me a question each. I think I was able to answer all the questions. Um, Most questions were like very practical oriented. They tell me like, assume you are a ward SR in the department, something like this happens. Now how will you manage? If an emergency comes like this, then how will you manage? All were like practical questions. And luckily, since I'm also coming from a background of head and neck surgery during my PG training, I have faced such incidents during my PG training. So I was able to answer it like, if such an emergency comes, how will I approach that case, approach that patient? So I was able to answer that. So all of it were like proper formal questions. Nothing. There was no other informal questions.
Great. Now, what is that amount message that you want to give for the junior aspirants who are aspiring for MCH head and neck surgery?
So I would like them to understand that it's definitely a long journey ahead. So if you are you should be pursuing MCS only if you are really passionate about the subject, and if you're indeed passionate, and if you are ready to give your sweat and blood to the department, to your patients, then you must follow it. And I think it's a very fruitful department to follow, sir. And I wish them all the best in their journeys ahead.
Great.
Yeah.
Time to thank and whom all you want to thank that they helped you from day one till date to build your
Yes,
career.
definitely, sir. Obviously, from the speed team, I definitely like to thank Teja, sir, and obviously, sir, to you also, sir. I used to watch your YouTube videos of like last 3 days, last 5 days, last 10 days. I used to always watch those videos. I found it very motivating. Your energy is kind of like contagious, sir. Like that. I really used to like watching those videos. Then, sir, then from my family, I'd like to thank my dad, my mom, and my sister. They were always there with me throughout my like such a long career. And after that, my faculties and my seniors and my juniors in my PG training in AIMS Raipur, and also in my current department in AIMS Kalyani. Especially, I would like to name my current HOD, Dr. Ajay Malik sir. He gave me ample amount of time to prepare for this exam. And also, I would like to thank my co-SRs who kind of like took on my duty, and they kind of replaced me during the work hours, especially Dr. Faisal. And also, I like to thank my friends Manasi, Adjo, Doro, then Joyce, Shruti. All these people had like took care of me, and they supported me during my preparation time. So without them, it wouldn't have been possible, sir. I'd like to thank all of them. They are so much imminent needed for the success as much as my hard work also, sir.
Great. It's a wonderful
Yes.
discussion and sharing of your experiences. And hope this video will be useful for a lot of aspirants.
Thank you so much, sir. Thank you.
Again, I wish you all the very best and all the success
Yes,
for a
sir.
great career ahead in MCH and onco
Yes.
surgery. Best wishes to you.
Thank you, sir.